To Nigeria now, and the country is applying for an $890 million grant from an international finance organization, the Global Fund, to reduce the burden of HIV, tuberculosis and malaria. The fund is meant to be spread between the years 2021 to 2023. However, experts say more needs to be done to utilize these funds in reducing the burden of preventable diseases in the country. Here's CGTN's Phil Ihaza with that report.
According to Dozie Ezechukwu, an executive of Global Fund Nigeria, malaria will take the highest allocation of $417.8 million, followed by HIV with $329.1 million and tuberculosis TB $143.5 million. The World Health Organization (WHO) states that Nigeria accounted for 86 million malaria cases globally in 2019, with HIV prevalence rate of 1.4% and second place of list of countries with the highest TB burden on the continent. Although in 2018, Global Funds donated $660 million to tackle HIV, tuberculosis and malaria epidemic in Nigeria, the country is still faced with a high prevalence of these preventable diseases. Experts say for Nigeria to make much progress in reducing the burden of these diseases with donor funds, the government will need to do more to be more transparent and accountable.
There should be an assessment of what has happened to the previous funds for these programs that have been dedicated to Nigeria over the years. That would help them learn what needs to be improved on. Otherwise, this money will come in and a few changes will happen, but it may not drive down the impact that they really set out to achieve.
Nigeria has recorded some progress in the fight against these diseases. According to data from the United Nations, the number of AIDS-related deaths reduced by 26% from 72,000 deaths to 53,000 deaths between 2010 to 2019. However, experts say beyond the impact of donor funds, much more progress can be achieved if individuals and health workers increase their sensitivity and proactiveness to health care.
People should learn to seek health care early, and then at the health facilities, our health workers can do better with enlightening people on the symptoms of these diseases, how to recognize them in their environment and quickly seek help. So a lot has to be done in terms of awareness creation for the causes of these diseases and how to treat them very, very early enough.
President Muhammadu Buhari has promised to increase budgetary allocation to the health sector and improve the quality and access to medical facilities across the country. Phil Ihaza, CGTN, Abuja.